In selling the Global Knee over the last 3 years, there have been some significant changes that have occurred in the marketplace that needed to be addressed, and we've addressed those in the Global Origin brace. The Global Origin is a brace that incorporates many of the features of the Global Knee, but in slightly different ways. We have medial lateral hinges that are incorporated into the brace for medial lateral stability. The brace is constructed from a cool neoprene, which actually allows 80% of the water vapor to escape, but keeps therapeutic heat and compression in and on the patient. And we've also incorporated the patellar sling and a calf adjustment that allows for the adjustment for conical knees. The Global Origin addresses 3 questions that our caregivers have sent to us that we needed to answer. The first is the concern for putting a brace on a patient when being used for conservative care, even for a very short period of time, and the caregivers not wanting their patients to have to pay $500, $600, $700, $1,000 out of pocket due to their insurance plans. Well, that's a great time for the Global Origin. Now, if they need to unload the joint, the Global Origin isn't going to do a great job of that. It's going to provide medial lateral stability. What it will do is address all of those OA knees, at least 50% of the knees that have anterior knee pain and need some medial lateral support. Many of the caregivers that we've called on are using an anterior closed hinge knee brace to treat their osteoarthritic patients. That may work fine when unloading is a concern and all you're going to be providing is medial lateral support to block a peak varus or valgus moment. But if that patient is experiencing significant anterior knee pain, that brace will not address that pain in the patient. And so then using this brace in conjunction with that anterior closed knee brace is a really great option for the Global Origin. As the marketplace changes, so does the reimbursement of products. And over the last number of years, documentation for instability is mandated when used for the larger knee braces like unloader braces and the Global Knees. If documentation for instability is not available, putting a brace on means it will not be reimbursed. And so, before a brace is applied, 2 things must either occur. Either you get documentation for instability, where they can actually see and prove instability in the joint. But if no instability is present, the surgeon just can't simply order a brace that will be reimbursed. And so that's where the Global Origin fits right in. This is a perfect brace to relieve pain and provide support in all of those anterior knee pained osteoarthritic patients. Doctor, do you see how the Global Origin can fit the need in your practice for those 3 things?